Good afternoon. My name is Madison Lassen, and today I am joined here with my mom, Jennifer Lassen. Today is March 7th.
Hi, how are you today?
I'm good. How are you?
I'm good, thank you very much.
Okay, thank you so much for taking the time to talk with me today. Let's start off with your journey of diabetes and how that's affected you. So how was having health insurance like when you were employed?
It actually was very easy to get my medication, where my supplies were covered except for my insulin. Um, and you were restricted to a certain brand through Kaiser, because they only had one option. If you got anything that was different than their option, then you would pay out of your pocket without any coverage at all.
Okay, and then when were you first diagnosed with diabetes?
In 2013, I was a late onset type 1 diabetes, which is very rare. You are normally born with it. And I developed it at age 30.
Were you employed at that time when you were diagnosed with diabetes?
I was a teacher in the local district, teaching a 3-4 combo. Um,
Okay, and then you said you have type 1 diabetes. How is that different from type 2?
Type 1 is something that you were born with, that you can't get rid of, and you rely on insulin because your body does not produce it. Type 2 is something that someone develops from bad eating habits and lack of exercise, being overweight. They can control it through diet, exercise, and sometimes with the help of a pill called metformin.
Okay, and then you said you were diagnosed in 2013. Tell me about 2013. You went into a coma that year, is that right?
That is correct. I was at a birthday party of a family friend, and I was not feeling too well when they were serving cake. And that family friend thought, why not let's test her blood sugar because the friend was also diabetic. And my blood sugar came up as 495. And that day was the day I went to the emergency room. And that year I was very angry that I was diabetic and didn't do what I was supposed to do and ended up in a diabetic coma for 5 days in November of that year.
Tell me about how diabetes has affected you working.
It makes a day-to-day activities very hard. Uh, Throughout the day, you forget to eat and your blood sugar gets too low and you feel like you're going to pass out, or you forget to give yourself a shot of insulin and your blood sugar gets so high you can't concentrate or focus in any way, and you tend to get angry and you feel like you're going to throw up. So it makes going the whole day very difficult because you just don't feel good no matter what you do.
And then when did you stop working?
Uh, I stopped working around 2 years ago, when I started to get really sick. I was having some issues in my life that caused my blood sugar to spiral. And then once I stopped working and lost my insurance, I also lost my ability to get insulin, which then made me even more sick and was not able to get another job at that point.
Was leaving work a choice for you? How did this happen?
Because my health had spiraled at that time, I was missing a lot of work. So I was not fired. I did not quit, but the district found a loophole and decided that if I could not call in sick via email the night before, then they were going to give me consequences. And unfortunately, I went into a diabetic coma and I was not able to call in sick. So they said that I abandoned my position. Therefore, they gave me papers and I was let go.
And what has been your health coverage since you left work?
I did not have health coverage for about a year after I had stopped working. So I was not able to get insulin, and I was in and out of the hospital 9 times out of 14 months in a diabetic coma. It took that many times to finally get the emergency Medi-Cal coverage, um, which then was covering my hospital visits, of which had built up over $1 million in hospital visits plus $50,000 in ambulance bills. I was able to finally get insulin through them, but they were transferring me to a hospital that I was not comfortable with. Apparently now I am unable to get my insulin. For some reason, my prescription has expired, despite the fact that I will always be diabetic.
And now with Medi-Cal, how much does one vial of insulin cost you?
Medi-Cal covers your insulin 100%, but they do not give you the brand that you are accustomed to. Despite many people saying that no matter what the brand is, all insulin is the same, that is not true. And because they had switched the brands through Medi-Cal and gave me off-brand, it has also caused me to be ill because the insulin has not worked the same as the prior insulin I was on.
Does Medi-Cal now cover most of your health costs?
It does. It covers it 100%. But again, right now, I'm unable to get insulin because Medi-Cal will not let me have the provider of Kaiser that has all of my medical records, where was able to call a doctor and have my prescription refilled. Unfortunately, they have restricted me to North Bay, whom I have never been with, has no medical record. I do not have a doctor set up, and will now take a month for new doctors to give me testing to confirm that I'm type 1 diabetic to then be able to get a new prescription. So Medi-Cal has now made it so I'm not able to get insulin for a minimum of 1 month.
And tell me about your experiences with healthcare system in the United States. What has been your major challenges or struggles with the system?
Uh, Major struggles in the system would be for them to have my medical records, for them to provide me the emergency medical coverage, and for them to provide me with any assistance after my hospital visits that is necessary for me to continue not to go back.
And what about our healthcare system would you like to see changed?
I would like to see the healthcare system realize that diabetics, type 1, can't live without insulin. Without medical insurance, we can't afford it. Without medical insurance right now, a vial of insulin for myself, one vial, and I need two types, lasts 3 weeks. Each vial without insurance will cost me $695. So, what I would like to see with the healthcare system is to realize that they are making it impossible for diabetics to live and afford to it. It should be a free thing because we can't live without it. Instead of making money off of people knowing very well we can't live.
Thank you so much for speaking with me today. I know this is a very important issue that I want to address, and I know um, it's something that you have to live with. And since I have been there with you, I have to live with it too.
Thank you so very much. And I'm so very sorry for what you've had to be put through in your childhood with my health issues and to watch your mama die twice.
Thanks, Mom. I love you.
I love you so much.